Okay, this is a coronavirus 19 themed message. What I really hate is when numbers are used to create propaganda, especially to generate fear. And this coronavirus situation is like that. We are being given, and the bigger the number, the more fear it generates in people. Bloomberg this morning comes on the news, and this is 3 April 2020, comes on and says 1 million people in the world, quote, are infected with the coronavirus. I don't care about the world. I care about the world I live in, and so should you. As Americans, we intentionally created recently 3 million refugees out of Syria, and nobody shed a tear. Bloomberg didn't stand up and say we shouldn't do that. Not a peep. We routinely will kill 200, 300,000 innocent civilians. Nobody in this country sheds a tear. We don't care, because it's those people over there. Right now, the Fauci or Trump or whoever is putting out a number that 200 to 250,000 Americans could die if we don't do blah, 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 blah. Right? 250,000 Americans might die if we don't do X. Well, first of all, that's a bullshit number. That's what we call a black swan number. That's a number that is so unlikely to happen, but it's really big, because we want you to still be afraid that we want to put that out there, because we're trying to control your behavior. There's a reason that we want you to stay at home and not go do anything. I mean, if we could, somebody would come up with the idea like the president of the Philippines just did yesterday and say, anybody caught outside not complying with stay at home, the orders are to shoot to kill them. This actually came out of the mouth of the president of supposedly a democratic country. I mean, that's how crazy some of this background energy, whatever's going on, is taking place. I mean, that's just amazing. Amazing that the next day there wasn't a revolution to oust him in the Philippines. I mean, amazing. But let's come back to America, right? There are cops being directed to write tickets and $1,000 fines for people who are outdoors, and some neighbor says, well, someone's violating the stay-at-home order or some such thing. Why? Because maybe 250,000 people might die, right? First of all, that's not going to happen. It's not even going to get close. And it wouldn't get that close even if no one stayed home, right? Because the healthcare system and governments are not able to cure or prevent the virus, they are terrified that the people might become restless. Well, what are you doing? What are you doing? How come you're not stopping this? Understand, everyone, you are your own first responder. You are your own responsible person. You. The government, nobody is going to come save you with this virus until there's actually a cure or a treatment that's effective and or a vaccine. And that's a ways down the road. Do you really expect to stay in house arrest? Because that's what they're demanding, house arrest. Because an unspecified 200,000 people in the whole country might die. There's 350 million of us. and we're going to worry about 250,000? Here's why that's really stupid. CDC data. CDC data. 500,000 people die every year in this country from heart disease. Heart disease. Do we implement draconian measures to prevent that? Of course not. We put out guidance. We say, eat this diet, do this exercise, don't smoke. Here's some things that you should do. But do we put the country on house arrest? Do we have exercise police? Do we have diet police to prevent 500,000 Americans from dying? Of course not. Oh, another 500,000 die every year from cancer, right? And there's no cure for cancer. But do we go around and have health police? Do we do any of those things? Do we put people under house arrest because we can't cure cancer yet? No. The problem with this virus is that, like all viruses, they are fast moving in general. And it is true that there is an at-risk population that in highly dense areas could and most probably would overwhelm the healthcare environment, which would then tend to cause some kind of unrest in the population. Back to the mayor of New York, the governor of New York. How come you guys can't fix this? My grandmama's dying, my baby's dying, my husband, wife, neighbor, whatever. You can't fix it. And the answer is no, we can't. All we can do is make you comfortable as you get through it and make those people who are going to die more comfortable. If you take a look at what's happening in hospitals, and some of this is unwritten but spoken, they're saying, well, we can't afford to get any more of our doctors or nurses sick, because not only does that take them away, so we have less people to treat the sick that do come in the hospital, but we also have a fewer number of places to put the people. So what they're now saying is, if anyone codes out, that is, they go into cardiac arrest or whatever because of the virus or the effects of the virus, they are now implementing unwritten do not resuscitate. Why? We can't afford to have 6 or 7 of our medical staff waste their masks, waste their gowns, waste their gloves to go in and deal with a person who will probably die anyway. Those conversations are being had inside hospitals today. Remember the idea of the death panel? Well, this is the death squad on steroids coming to a hospital near you, right? If you don't believe me, go talk to some people that you know that are in healthcare. So the $250,000 number is unrealistic. It's way too high, and it doesn't matter anyway. Because you come back and ask, do we close down the entire economy, have more people die from other reasons just because of that? And the answer should be and should have been no. And the governor of Florida, I don't know what Trump or somebody blew in his ear the next night, but now he's a coward. He's a coward for having reneged on his promise to never lock down the state. He's a coward. And or he was bought off in some kind of way. Right? Let's talk about the language of war. Now, I've been to war, and some of you have been war fighters too. This is not a war. It is not a war. Why? A war implies that you are fighting it, and there will be casualties. There will be casualties. No commander goes into war without understanding what the probability of casualties are, and then makes a judgment call: is the juice worth the squeeze? Is the juice worth the squeeze? I know as a commander of X, I'm going to lose probably X number of my troops to go take that objective, right? That means that X number of healthcare workers are going to be lost by treating those people. And oh, by the way, doctors and nurses are not on the front lines. They are not. The only people ever on the front lines of a war are medics and corpsmen. Everybody else is in the rear. Every once in a while you might get rocketed or mortared or bombed. But the frontline medical people today would be considered the EMTs in the bus going to pick up somebody and carry and transfer them to a rear facility, in this case being a hospital, right? Or some other kind of health delivery situation. So stop worrying about this big number. Yes, more people will probably die, but it won't be that. And oh, by the way, unless you're given all the data, and what is all the data? All the data is how many, oh, by the way, watch the word that they use. Infection only means that the virus, that your body, you have been tested, and you now have antibodies to the virus, which means you have been or were or are infected by the virus. That's all it means. The virus has been or is present. That's an infection. A case is somebody who has symptoms and is sick, right? They're not the same thing. So what do we want to know? How many people have been tested out of the population that's targeted, which should be everybody, right? But that ain't going to happen. And of the people tested, how many tested negative? That means negative for the antibodies. Why were they tested in the first place? Because they had some kind of symptoms that suggested that they be tested. So of the number of tests, what percentage have tested negative? I will tell you that that number is probably 50%. That's 50%, right? Then, of the people that tested positive, that means all they have is the virus is there. How many have no symptoms? That's 25%. That's a big number. Then of the rest, how many have mild symptoms? In other words, they do not require hospitalization. That's another big number. Then of that, the remaining, how many require hospitalization of some type, but not the ICU? And then the last one is how many people died. What you will find is that most people, are going to get through this thing just fine. Just fine. We should not ever have had this lockdown thing just because the healthcare system might be overwhelmed. That was a brain dead move, and I stand by that. Right? Well, people will die. We got 1 million people dying from heart disease and cancer, right? Let's pay attention to that for a hot minute, all right? And we don't collapse the economy for those million. Why would we collapse the economy for, I'm saying, going to be much less than the 250,000, probably 100,000, if that. If that. And if it happens to be biased toward New York City and Seattle and San Francisco, that's their bad luck. That's just their bad luck, right? You don't collapse the country because of that. So, those are my thoughts. I don't want to make another one of these coronavirus things. I like to talk about guns and ammo and prepping and other stuff. But remember, you are your own first responder. You personally are responsible if you are an at-risk person, but you want to have company. It's your responsibility if you invite someone into your house that may have been exposed, may have the virus and may be asymptomatic. But you're making a decision that you would rather be with someone than be alone. And screw this social distancing thing. What a joke. Nobody's really doing that, really. Right? If you're an at-risk person, it's your responsibility to protect yourself. It's not someone else's responsibility to protect you. And oh, by the way, no one is coming. No one is coming, right? So you're responsible to take your own precautions. The rest of the country is not responsible for you. You are responsible for you, just like I'm